Hello everyone, good afternoon and welcome to today's presentation. In this video, we are going to have a look at piles or hemorrhoids. Piles or hemorrhoids. So this is what we'll be looking at in this video. We'll have an overview of piles. We also look at the types of piles. We'll look at the symptoms of piles or hemorrhoids, causes of piles or hemorrhoids. We'll look at the preventive measures, the treatments, home remedies for piles. Then we'll have a look at the diagnosis for piles or hemorrhoids. But before we continue, once again, don't forget to subscribe to this channel. Hit the bell so that you'll be notified anytime a new video is uploaded. Also, do well to leave all your questions or comments in the comment section, and also share this video so others can also see it. Thank you. So, overview of piles or hemorrhoids. Hemorrhoids, also called piles, are swollen, enlarged veins that form inside and outside the anus and rectum, similar to varicose veins. They can be painful, uncomfortable, and cause rectal bleeding. We are all born with hemorrhoids, but at baseline, they don't bother us. It's only when they become swollen and enlarged that they produce irritating symptoms. Nearly 3 out of 4 adults will have hemorrhoids or piles from time to time. They affect people of all ages, genders, races, and ethnicities. They are more common as you age, affecting more than half of people over age 50. They often get better on their own after a few days. There are things you can do to treat and prevent piles or hemorrhoids. It's completely normal to have blood vessels in your anus, as they play an important role in continence. Piles develop or can develop if these blood vessels become enlarged, which can cause symptoms. Piles usually look like small, round, discolored lumps. You might be able to feel them on your anus or hanging down from your anal canal. Your anal canal is a short, muscular tube with blood vessels that connects your rectum, that's your back passage, with your anus. Piles often don't cause any problem but can cause bleeding and sometimes pain. If they do cause any bleeding or pain, then you should see a doctor. A pile can hang down, that's prolapse, and can be felt outside the back passage. Often, it can be pushed back up after you have been to the toilet. However, more severe piles remain permanently prolapsed or hang down and cannot be pushed back inside. So let's look at the types of piles. The first one is external piles or external hemorrhoids. External piles are swelling that develop further down your anal canal, closer to your anus. They can be really painful, especially if they have a blood clot in them. External piles start off nearer the surface, below a 0.2 to 3 centimeters inside the back passage. Signs and symptoms of external hemorrhoids might include itching or irritation in your anal region, pain or discomfort, swelling around your anus, bleeding. It's possible to have both internal and external piles at the same time. Despite the name, external piles aren't always seen outside of the opening of the back passage, that's the anus. Equally confusing, internal piles can enlarge and drop down, that's prolapse, so that they hang outside of the anus. If blood pools in an external hemorrhoid and forms a clot, that's thrombus, it can result in severe pain, swelling, inflammation, a hard lump near your anus. So this is an external hemorrhoid. You can see it from the opening of the back passage or the anus. In this picture too, you can see it here. So this is an external hemorrhoid. Another type of hemorrhoid is what we call an internal hemorrhoid or internal pile. So what are they? Internal hemorrhoids or piles lie inside the rectum. You usually can't see or feel them, and they rarely cause discomfort. But straining or irritation when passing stool can cause painless bleeding during bowel movements. You might notice small amounts of bright red blood on your toilet tissue or in the toilet. A hemorrhoid to push through the anal opening, that prolapse or protruding hemorrhoid, resulting in pain and irritation. Internal piles are deeper and initially form above a point 2 to 3 centimeters inside the back passage, in the upper part of the anal canal or lower rectum. Internal piles start inside your anal canal, but they might hang down and come out of your anus. They are graded according to whether they come out, and if so, how far they come out. So based on these grades, we have 1. First degree piles, and they may bleed but don't come out of your anus. You also have the second degree piles. They come out of your anus when you have a poo, but go back inside on their own afterwards. Third degree piles come out of your anus and only go back inside if you physically push them back in. Fourth degree piles always hang down from your anus and you can't push them back in. They can become very swollen and painful if the blood inside them clots. So these are some pictures of what we just discussed. This is an external hemorrhoid. This is also an internal hemorrhoid. This is an internal hemorrhoid. This is the rectum, an external hemorrhoid. So this is a first degree internal hemorrhoid. You can see it from this picture. This is also a second degree internal hemorrhoid. So with this type of hemorrhoid, when you have a poo, it goes back inside when you are done. So you can see the third degree piles or hemorrhoids over here. And with this, after you have a poo, you have to physically push them back inside. If not, they will not go. Then we have the fourth degree piles or hemorrhoids. And with this kind of internal piles, they are always hanging down and you cannot push them back in. So symptoms of piles or hemorrhoids. The symptoms of piles or hemorrhoids. The most common pile symptom is bleeding after going to the toilet to pass stools or feces. The blood is usually bright red and may be noticed on the toilet tissue, in the toilet pan or coating the stools. Sometimes there are no symptoms and you may not realize that you have piles. Small internal piles are usually painless. Larger piles may cause a mucus discharge, some pain, irritation, and itch. The discharge may irritate the skin around the anus. You may have a sense of fullness in the anus or a feeling of not fully emptying your back passage when you go to the toilet. Hemorrhoids or piles aren't usually painful unless their blood supply slows down or is interrupted. Piles don't always cause pain or other symptoms, but if you do have symptoms, they might include 1. Bleeding when you poo. You may see blood, usually bright red, on the toilet paper or drips in the toilet or on the surface of your poo. 2. A lump in or around your anus. A lump hanging down outside of the anus which may need to be pushed back in after passing a stool. 3. A slimy discharge of mucus from your anus which may stain your underwear or on toilet paper after wiping your bottom. A feeling of fullness and discomfort in your anus, or a feeling that your bowels haven't completely emptied after you've gone to the toilet, feeling like you still need to poo after going to the toilet. Also, itchy or sore skin around your anus, and also pain and discomfort after you go to the toilet. That's pain around your anus. These symptoms can vary a lot between individuals. They may also be caused by problems other than bowel, such as inflammatory bowel disease, anal cancer, bowel cancer, and an anal fissure or tear. So, if you have any of these symptoms, contact your doctor for advice. Don't just assume they are caused by piles or hemorrhoids. Causes of piles or hemorrhoids. The lining of the back passage, that the anal canal, contains many blood vessels or veins. There seems to be certain changes in the veins within the lining of the back passage that cause the piles to develop. The lining of the back passage and the veins become much larger, and this can then cause a swelling and develop into a pile. However, we don't know exactly what causes a pile. Some piles seem to develop for no apparent reason. It is thought that there is an increased pressure in and around the opening of the back passage, that's the anus. This is probably a major factor in causing hemorrhoids in many cases. If you delay going to the toilet and need to strain when on the toilet, then this can increase the pressure and makes it more likely that a pile will develop. Things that make piles or hemorrhoids more likely. 1. If you strain when you go to the toilet, for example, if you have constipation or long-lasting diarrhea. 2. Getting older. Your anal canal weakens with age, which makes piles more likely. 3. Lifting heavy objects. Constipation. Passing large stools or feces and straining at the toilet. These increase the pressure in and around the veins in the anus and seem to be a common reason for piles to develop. Being overweight. This increases your risk of developing piles. Pregnancy. Piles are common during pregnancy. This is probably due to the pressure effects of the baby lying above the rectum and anus, and also the effect that the change in hormones during pregnancy can have on the veins. Piles occurring during pregnancy often go away after the birth of the child. Hereditary factors. Some people may inherit a weakness of the wall of the veins in the anal region. Sitting down for long periods of time. Having anal intercourse. Prevention of piles. How to prevent piles or hemorrhoids. Making lifestyle changes to reduce the strain on the blood vessels in and around your anus is often recommended. These can include: eat more fruits, vegetables, and whole grains. Doing so softens the stool and increases its bulk, which will help you avoid the straining that causes hemorrhoids or piles. Add fiber to your diet slowly to avoid problems with gas. Consider fiber supplements. Most people don't get enough of the recommended amount of fiber, that is the 20 to 30 grams a day, in their diet. Studies have shown that over-the-counter fiber supplements, such as psyllium or methylcellulose, improve overall symptoms and bleeding from hemorrhoids or piles. If you use fiber supplements, be sure to drink at least 8 glasses of water or other fluids every day. Otherwise, supplements can cause or worsen constipation. If a high fiber diet is not helping, you can take fiber supplements as bulking agents, such as spegula, bran, or steculia. Drinking plenty of fluid, particularly water, but avoiding or cutting down caffeine and alcohol. Also, drink plenty of fluids. Drink 6 to 8 glasses of water and other liquids, not alcohol, each day to help keep stools soft. Not delaying going to the toilet. Ignoring the urge to empty your bowels can make your stools harder and drier, which can lead to straining when you go to the toilet. Don't strain. Straining and holding your breath when trying to pass a stool creates greater pressure in the veins in the lower rectum. Avoiding medication that causes constipation, such as painkillers that contain codeine, such as co-codamol, as they are a common cause of constipation. Exercise regularly. This exercise can help prevent constipation, reduce your blood pressure, and help you lose weight. Stay active to help prevent constipation and to reduce pressure on veins, which can cause with long periods of standing or sitting. Exercise can also help you lose excess weight that might be contributing to your hemorrhoids or piles. Avoid long periods of sitting. Sitting too long, particularly on the toilet, can increase the pressure on the veins in the anus. Treatment for piles. If you have piles, it can be very uncomfortable, and it's understandable if they make you feel a bit self-conscious. They might have an effect on other areas of your life, such as your sex life, if your piles hang out or you have some discharge. But try not to worry. Piles usually last less than a month and then shrink back, although they might come back. Hemorrhoids or piles often clear up by themselves after a few days without needing treatment. However, there are many treatments that can reduce itching and discomfort. Hemorrhoids that occur during pregnancy often get better after giving birth. Medication that you apply directly to your back passage, known as topical treatments or tablets, bought from a pharmacy or prescribed by your doctor, may ease your symptoms and make it easier for you to pass stools. Surgery carried out under general anesthetic, where you are unconscious, is sometimes used to remove or shrink large or external hemorrhoids or piles. If there is no improvement to your piles after home treatments, you may need hospital treatment. Talk to your doctor about the best treatment for you. Treatment does not always prevent piles coming back. So common hospital treatments for piles or hemorrhoids include 1. Rubber band ligation. 2. Sclerotherapy. 3. Electrotherapy. And 4. Infrared coagulation. So let's have a look at rubber band ligation. Banding is a non-surgical procedure where a very tight elastic band is put around the base of the hemorrhoid to cut off its blood supply. The hemorrhoid should fall off after about a week. Banding is usually a day procedure that doesn't need an anesthetic, and most people can get back to their normal activity the next day. You may feel some pain or discomfort for a day or so afterwards. Normal painkillers are usually adequate, but your doctor can prescribe something stronger if needed. You may not realize that your hemorrhoids have fallen off, and they should pass out of your body when you go to the toilet. If you notice some mucus discharge within a week of the procedure, it usually means that the hemorrhoids or piles have fallen off. Directly after the procedure, you may notice blood on the toilet paper after going to the toilet. This is normal, but there shouldn't be a lot of bleeding. If you pass a lot of bright red blood or blood clots, that is solid lumps of blood, go to your nearest accident and emergency department immediately. Ulcers, that's open sores, can cause at the site of the banding. Although these usually heal without needing further treatment. So ulcers can occur at the site of the banding, although these usually heal without needing further treatment. A small number of people have complications following banding, such as bleeding, infection, or ulcers forming at the site of a treated hemorrhoid or bowel, or even urinary problems. So, sclerotherapy. Also, a treatment called sclerotherapy may be used as an alternative to banding. During sclerotherapy, a chemical solution is injected into the blood vessels in your back passage. This relieves pain by numbing the nerve endings at the site of the injection. It also hardens the tissue of the hemorrhoid or bowel so that a scar is formed. After about 4 to 6 weeks, the hemorrhoid should decrease in size or shrivel up. After the injection, you should avoid strenuous exercise for the rest of the day. You may experience minor pain for a while and may bleed a little. You should be able to resume normal activities, including work, the day after the procedure. So let's have a look at the third hospital treatment, which is electrotherapy. Electrotherapy, also known as electrocoagulation, is another alternative to banding for people with smaller hemorrhoids. During the procedure, a device called a proctoscope is inserted into the anus to locate the hemorrhoid. An electric current is then passed through a small metal probe that's placed at the base of the hemorrhoid, above the dentate line. A specialist can control the electric current using controls attached to the probe. The aim of electrotherapy is to cause the blood supplying the hemorrhoid to coagulate or thicken, which causes the hemorrhoid to shrink. If necessary, more than one hemorrhoid can be treated during each session. Electrotherapy can either be carried out on outpatient basis using a low electric current, or a higher dose can be given while the person is under a general anesthetic or spinal anesthetic. You may experience some mild pain during or after electrotherapy, but in most cases, this doesn't last long. Rectal bleeding is another possible side effect of the procedure, but this is usually short-lived. Electrotherapy is recommended by the National Institute for Health and Care Excellence. It has been shown to be an effective method of treating smaller hemorrhoids or piles. It can also be used as an alternative to surgery for treating larger hemorrhoids, but there is less evidence of its effectiveness. Infrared coagulation, another hospital treatment. Your doctor will apply an infrared light to certain areas of the piles or hemorrhoids, which will cut the blood supply to your piles and make them shrink. It seems to be as effective as banding treatment and injection sclerotherapy for first and second degree piles. Also, there are different types of surgery for piles, which can include the following. But before then, let's have a look at some pictures illustrating these four hospital treatments. So this is the banding. You can see the rubber band tied to the hemorrhoid. So with time, it will fall off. And this is the sclerotherapy, where a fluid is injected. You can see the syringe and the needle here. This is the electrotherapy. And this is the infrared coagulation method or hospital treatment method. So, surgical treatment for piles also include the following. 1. Hemorrhoidectomy. 2. Stapled hemorrhoidopathy. And then 3. Hemorrhoidal artery ligation. So let's go into detail and have a look at these 3 surgical treatments. So, what is hemorrhoidectomy? This is an operation to cut away the hemorrhoids, and it is an option to treat grade 3 or 4 piles, that is 3rd degree or 4th degree piles, or for piles not successfully treated by banding or other methods. The operation is done under general anesthetic and is usually successful. However, it can be quite painful in the days following the operation. A conventional hemorrhoidectomy involves gently opening the anus so the hemorrhoids can be cut out. You will need to take a week or so off work to recover. You may still have pain a few weeks after the procedure, which can be controlled with painkillers. Seek medical advice if you have pain that continues for longer periods. After having a hemorrhoidectomy, there is around a 1 in 20 chance of the hemorrhoids returning, which is lower than with non-surgical treatments. Adopting or continuing a high-fiber diet after surgery is recommended to reduce this risk. Stapled hemorrhoidopathy. With this method, your piles are stapled back inside your anus. In this operation, your surgeon will attach the area of tissue with piles higher up your anal canal and staple it in place. Your piles or hemorrhoids then won't come out of your anus anymore and will shrink. A circular stapling gun is used to cut out a circular section of the lining of the back passage above the piles. This has the effect of pulling the piles back up the back passage. It also has the effect of reducing the blood supply to the piles, and so they shrink as a consequence. Because the cutting is actually above the piles, it is usually a less painful procedure than the traditional operation to remove the piles. It's sometimes used to treat prolapsed hemorrhoids and is carried out under general anesthetic. The procedure isn't carried out as often as it used to be because it has a slightly higher risk of serious complications than the alternative treatments available. Stapling has a shorter recovery time than a traditional hemorrhoidectomy, and you can probably return to work about a week afterwards. It also tends to be a less painful procedure. However, after stapling, more people experience another prolapsed hemorrhoids compared with having a hemorrhoidectomy. There have also been a very small number of serious complications following the stapling procedure, such as fistula to vagina in women, where a small channel develops between the anal canal and the vagina, or rectal perforation, where a hole develops in the rectum. The third method or type of surgical treatment, that is hemorrhoidal artery ligation. With this, stitches are used to cut the blood supply to your piles to make them shrink. During this procedure, arteries in your anal canal are closed to limit the blood supply to your piles. Sometimes an ultrasound probe will be used to help find your arteries and guide your surgeon during the procedure. The probe produces high-frequency sound waves that allow the surgeon during the procedure. Sorry. The probe produces high-frequency sound waves that allow the surgeon to locate the vessels supplying blood to the hemorrhoid. Each blood vessel is stitched close to block the blood supply to the hemorrhoid, which causes the hemorrhoid to shrink over the following days and weeks. The stitches can also be used to reduce prolapsing hemorrhoids, that is, hemorrhoids that hang down from the anus. It's usually carried out under general anesthetic. The National Institute for Health and Care Excellence recommends hemorrhoidal artery ligation as a safe and effective alternative to hemorrhoidectomy or stapled hemorrhoidopathy. It causes less pain, and in terms of results, a high level of satisfaction has been reported. The recovery time after having hemorrhoidal artery ligation is also quicker compared with other surgical procedures. There is a low risk of bleeding, pain when passing stools, or the hemorrhoid becoming prolapsed after this procedure, but these usually improve within a few weeks. So these are some pictures to illustrate what we talk about, that is various surgical treatments. So this is hemorrhoidectomy. This is the stapled hemorrhoidopathy. So let's look at some home remedies for piles or hemorrhoids. You can often relieve the mild pain, swelling, and inflammation of hemorrhoids with home treatments. Eat high fiber foods. Eat more fruits, vegetables, and whole grains. Doing so softens the stools and increases its bulk, which will help you avoid the straining that can worsen symptoms from existing hemorrhoids or piles. Add fiber to your diet slowly to avoid problems with gas. Use topical treatments. Apply an over-the-counter hemorrhoid cream or suppository containing hydrocortisone, or use pads containing witch hazel or a numbing agent. Soak regularly in a warm bath or sit bath. Soak your anal area in plain warm water for 10 to 15 minutes, 2 to 3 times a day. Take oral pain relievers. You can use acetaminophen, aspirin, or ibuprofen temporarily to help relieve your discomfort. Also, drink more water. With these treatments, hemorrhoid symptoms often go away within a week. See your doctor in a week if you don't get relief, or sooner if you have severe pain or bleeding. Use toilet paper with lotion or flushable wet wipes to gently pat and clean your bottom after pooping. You can also use a tissue or washcloth moistened with water. So, general risks of hemorrhoid surgery. So, these are the various general risks of hemorrhoid or pile surgery. Although the risk of serious problems is small, complications can occasionally occur after hemorrhoid surgery. These can include bleeding or passing blood clots, which may happen a week or so after the operation. Infection, which may lead to a buildup of pus known as an abscess. You may be given a short course of antibiotics after surgery to reduce this risk. Urinary retention, that's difficult to empty your bladder. Fecal incontinence, that is the involuntary passing of stools. Anal fistula, that's a small channel that develops between the anal canal and surface of the skin near the anus. Stenosis, that's narrowing of the anal canal. This risk is highest if you have treatment on hemorrhoids that have developed in a ring around the lining of the anal canal. These problems can often be treated with medication or more surgery. Ask your surgeon to explain the risks in more detail before deciding to have surgery. So diagnosis. Diagnosing piles or hemorrhoids. How are hemorrhoids or piles diagnosed? Your doctor will ask about your symptoms and examine you. They may gently put their fingers into your anus to feel your rectum. They will wear gloves and use some gel to make it more comfortable. If necessary, your doctor may refer you to a specialist doctor to look inside your rectum using a short, rigid tube-like instrument called a proctoscope. In this procedure, the inside of your back passage or anus is examined using an instrument called a proctoscope. You may be referred to a specialist for more detailed bowel examination to help rule out other conditions. You might need to have a blood test to check if you have anemia, if you have a lot of bleeding. If your symptoms, examinations, or test results suggest your symptoms might be caused by something else, your doctor may refer you to hospital for more tests. These can rule out other conditions such as bowel cancer. So, questions to ask your doctor. If you visit a hospital or your doctor, these are the questions that you can ask him or her. So, for hemorrhoids, some questions to ask your doctor include: what's the likely cause of my symptoms? Is my condition likely to be temporary or permanent? Am I at risk of complications related to this condition? What treatment approach do you recommend? If treatments we try first don't work, what will you recommend next? Am I a candidate for surgery? Why or why not? Are there additional self-care steps that might help? I have other medical problems. How can I manage this along with hemorrhoids or piles? And these are some of the questions that you should also expect from your doctor when you visit him or her. Your doctor is likely to ask you questions including: how uncomfortable are your symptoms? What are your typical bowel habits? How much fiber does your diet contain? What, if anything, seems to improve your symptoms? What, if anything, appears to worsen your symptoms? Has anyone in your family had hemorrhoids or cancer of the colon, rectum, or anus? Have you had a change in your bowel habits? During bowel movements, have you noticed blood on your toilet paper, dripping into the toilet or mixed into your stools? So, these are the questions that you should also expect from your doctor when you visit him or her regarding hemorrhoids or piles, or when you have symptoms of hemorrhoids or piles. So, rather, we've come to the end of this video or presentation. Thank you very much, and once again, don't forget to subscribe to this channel. Subscribe and click on the bell so that you'll be notified anytime a new video is uploaded. Also, don't forget to leave all your comments and questions in the comment section. Like this video and also share so your colleagues can also see this video. Thank you very much and have the best of the day. Thank you.